Wisp Sports Radio, the voice of women in sport.
Hi, and welcome to episode 10 of Ready, Steady, Rehab on Wisp Sports Radio, where we believe women in sport deserve equal coverage. Wisp Sports Radio is brought to you by Highlands Earache Drops.
Earaches are one of the primary causes for doctor visits, with over 30 million visits per year. After you've been diagnosed with an earache by a physician, try Highlands Homeopathic Earache Drops and Tablets. Highlands Homeopathic Ear Drops and Tablets provide natural relief to help you get back to doing what you love. Visit highlands.com/ear-pain to find a retailer near you. Claims are based on traditional homeopathic practice, not accepted medical evidence, not FDA evaluated. Read and follow label directions.
Ready, Steady, Rehab is a podcast about sports injuries, what can cause them, the symptoms to look out for, and the rehabilitation process. Welcome to the show. I'm Dr. Heather North, Doctor of Physical Therapy from Red Hammer Rehab. And on today's episode, I'm going to be talking a little bit about cracking your knuckles and other snapping and cracking that the joints of your body might be making. This is kind of a fun topic. I wanted to do something a little bit different. I had asked several of my patients and friends some stuff that they might kind of want to learn about, and this was something that actually came up a couple of times, and I hear this all the time at the office. So, cracking your knuckles. Is this an old wives' tale, or is there any efficacy to these statements? Is it bad for you? Does it make your joints swell? Will it limit your range of motion as you get older? Does it cause arthritis? Absolutely, it is. It is a totally an old wives' tale. There is no truth to any of those statements. There's no research that shows that, and in a little bit further on in our podcast, we're going to go into kind of actually why it's helpful and that you might want to be cracking those joints a little bit more than you do. So what's that noise that you hear when you crack your fingers or when you go to see your physical therapist and they manipulate your back? It's basically just gas escaping the synovial fluid with a quick stretch or movement. So that's that pop that you're hearing. Some things that I always like to ask patients, if you're hearing popping and snapping around your body, first of all, is it painful? And if the answer is no, usually it's nothing to kind of be too concerned about. All of us kind of tend to have a little bit more sway one way or another to pop or crack, especially as we get a little bit older, things get a little bit stiffer, and that can make some noise. If it is painful, that is definitely something to be a bit concerned about. See your doc, see your physical therapist, and kind of ask them a little bit more about the situation. Does it cause inflammation? Again, if the answer is no, nothing to be too concerned about. If the answer is yes, of course, especially in knees, joints, if you're hearing a lot of cracking and popping and afterwards you're getting a lot of inflammation or swelling, that's something to definitely be concerned about. And does it cause the tissue to hurt afterwards? So if it's cracking, popping a ton, and then the next day you're finding that you're really kind of feeling a lot of discomfort, that is something to be concerned about. But if the answer to all those questions is no, definitely don't get too concerned about that. So, it's not to say you should be cracking your knuckles on a regular basis, but, joint manipulation, joint movement can increase elasticity. It can release endorphins in the tissue. Although it's irritating to your office mates and friends, sometimes it can actually be a really helpful process.
A world of triathlon from the sports dynamic duo. Listen to the Siri and Beck Show on Wisp Sports Radio.
Hi, I'm Siri. Siri.
And I'm Beck from Believe Ranch and Rescue.
We are thrilled that Believe Ranch and Rescue has been chosen as the official charity for WISP Sports coverage of the FEI World Equestrian Games.
Chris Stafford will be bringing daily coverage of the games from September 11 to 23 on the Horse Show podcast and on WISP Sports Facebook page live with live video coverage. Be sure to stay tuned for that.
WISP Sports Radio.
One thing I hear questions a lot about are, my hip makes this kind of snapping noise when I'm raising and lowering my legs. Basically, this is just your deep muscles inside the pelvis, your hip flexors, kind of sliding back and forth over bony prominences. And again, those bony prominences can be different from person to person. It can be from tight musculature. It's nothing really to be too concerned about, again, as long as it's not causing discomfort. So how to decrease the incidence of this, make sure that when you're doing any leg lifts, things like that, you are tucking that pelvis under, kind of like, bad dog tucks its tail under, and that you are stretching your hip flexors. That's that kind of knelt posture where you're tucking the pelvis and squeezing your gluteal muscles to make sure that you're stretching those muscles in the front of your leg. All right, knee noises, the kind of grinding noise that you might hear when you're bending and moving around. And again, as long as this isn't painful, it's nothing to be too concerned about. So it's something called chondromalacia, and that's basically a roughening on the underside of your patella or your kneecap. And that's just common with active individuals, and especially as we age as human beings. So it's not necessarily something that you want, but it's something that we kind of all get a little bit. So how do you decrease the noises that this makes or the risk of it progressing? So first of all, you want to make sure that you're keeping your quads super loose by stretching. You want to be rolling the fronts of your quads. And you also don't want to be spending tons of time with your knees bent. So again, if you're at your desk, pop your feet up on a little ottoman or something up under the desk that you can bring your knee into that straightened position. All right, and this gets us into more of the medical joint manipulations, the joint manipulations that you're going to find with your doctor of physical therapy, basically anything from the top of the head to the tips of the toes that they can manipulate. Usually we use these techniques, again, these are all research-based techniques to help with mobility. And there's also some research that's really showing that it does release endorphins, which can make you feel really good. And that's that pop noise that you hear. And the cavitation is what I think patients are always kind of out for. But again, remember, if you're seeing your PT, don't be too concerned if you don't hear a pop, crack, or snap. It's really taking that joint into end range and forcing it just a little further. That's really kind of grade 5 manipulation that we're talking about. So again, don't be too worried about that. But thoracic manipulations, really, really safe. I always tell patients, even if you're having your children or spouse or friend walk on your thoracic spine, and again, that's kind of like right around the bra strap area and up a little bit, or in men, heart rate monitor strap and up, that's very, very safe. Lumbar manipulations, side lying, that's totally fine, unless you've been diagnosed with something like major instability of the lumbar spine or cervical spine, which is your neck. You don't want to be doing a lot of self-manipulations. But cracks and pops, again, really normal. It is an old wives' tale, so you can go ahead and tell your friends and family, don't worry, that they should start enjoying that popping noise.
Conversations from the world of women's sports. This is WISP Sports Radio.
I hope you found this fun episode helpful, and if you'd like some more information, please visit my website at redhammerrehab.com. It's provided on the show notes. You can also email info@wispsports.com with any questions you may have about sports injuries. On our next episode, we're going to be talking a little bit about finding that right running shoe for yourself and also finding your right orthotic. And those are very, very important things for athletes. And so there's also going to be some links in the show notes accompanying this episode at wispsports.com. Just go to listen and click on Ready, Steady, Rehab. For more conversations from the world of women's sport, visit wispsports.com and subscribe to Wisp Sports Radio. You can also post your comments and share on social media. Just look out for at Red Hammer Rehab and at Wisp Sports. Please visit our sponsors at highlands.com/ear-pain. Thank you so much for listening and supporting women in sports.